Hello, my name is Barbara Mendez. I am a family nurse practitioner student, and today we'll be doing the abdomen, rectal, and GU exams. First, I'm going to be showing you a 360 view of the room. I will not be using a note card. Here's my equipment. First, I'm going to start by performing hand hygiene and donning PPE. I am going to introduce myself to my patient. Hi, my name is Barbara Mendez, and I am a student family nurse practitioner. Is it okay if we perform this exam?
Yes.
All right. So, first I'm going to verbalize the MLGU exams. I'm going to perform hand hygiene, don my gloves, ensure privacy, and I'm going to ask the patient to stand. First, with adolescent patients, I'm going to assess for tenor staging. Then I'm going to inspect the skin and pubic hair for any inflammation, excoriations, or lice. Then I'm going to inspect the penis for any deformities or lesions. Then I'm going to assess the prepubis for any phimosis. I'm going to retract the foreskin or ask the patient to retract it. Then I'm going to inspect the glands for any inflammation or masses. Then I'm going to inspect the urethromeatus for any hypospadias or lesions. Then I'm going to gently compress the urethromeatus with my thumb and index finger and palpate for any and assess for any discharge. Then I'm going to inspect the scrotum for color and contour. I'm going to gently lift the scrotum to visualize the posterior surface. Then with palpation, I'm going to palpate the inguinal lymph nodes bilaterally. I'm going to palpate the shaft of the penis. With the inguinal lymph nodes, I'm going to assess for size, consistency, and tenderness. For the shaft of the penis, I'm going to palpate for any tenderness, nodules, masses. Next, I'm going to palpate the testes bilaterally using my thumb and my first two fingers. I'm going to palpate each testy for size, shape, consistency. A normal testy is smooth, ovoid, symmetrical in size and shape. Then I'm going to palpate the epididymis for tenderness or masses. Then I'm going to palpate the cords for tenderness or masses. Lastly, I'm going to palpate the external inguinal rings and the internal inguinal rings for any tenderness or masses. I'm going to assess the right side with my right hand and the left side with my left hand. I'm going to ask the patient to cough and noting any bulges. And that concludes the GU exam. Then I'm going to verbalize the female GU exam. I'm going to wash my hands, don gloves, ensure privacy, and I will educate the patient that she can ask to stop at any point if she feels uncomfortable or has any discomfort. First, with inspection, I'm going to visualize the labia majora, mons pubis, and perineum for any lesions, swelling, erythema, masses. Then I'm going to separate the labia to visualize external genitalia. I'm going to visualize the labia minora, clitoris, urethromeatus, and introitus for any lesion, swelling, erythema, masses, or discharge. With Bartholomew glands are normally not felt or seen, but if there's labial swelling, I will palpate these and note any tenderness or discharge. Next, with the speculum exam, I will inform the patient that she will feel the speculum being inserted and feel my fingers. I will insert the warm speculum into the vagina with a slight angle with downward pressure. I will advance it far enough to visualize the cervix. With retroinverted uterus, I will aim towards the umbilicus. Next, I will visualize the cervix for its normal pink color. In pregnancy, is tinted blue. I will open the speculum to visualize the cervix for any excoriations or lesions. I will reposition the speculum as needed. I will visualize the cervical os for any discharges, bleeding, and its size. Next, I will perform the pap smear. I would perform this before other diagnostic tests. If appropriate, I will collect the endocervical and ectocervical specimens. If appropriate, I will collect other diagnostic tests like the wet prep and KOH specimens at this time. With females, I will visualize the vaginal mucosa as I'm loosening the screw of the speculum and withdrawing the speculum, leaving it slightly open to visualize the vaginal wall's normal pink color. And I will also inspect for any lesions or masses. Now for the bimanual exam, I am going to lubricate my 2 fingers and inform the patient that she should feel my fingers being inserted into her vagina. I'm going to insert my lubricated fingers and ask the patient to bear down, noting the muscle tone and any nodules. Next, I am going to move the cervix and palpate for its size, shape, consistency, mobility. Then with palpating the uterus, I'm going to use my other hand to press in between the umbilicus and symbis pubis, and I'm going to palpate to feel the uterus edge and feel for any masses, tenderness, consistency, mobility, size. Then I'm going to palpate the adnexia. I'm going to palpate to try to feel the ovaries in between my hands, normally that are not felt. I am going to feel for the size, shape, consistency, mobility. With females, the rectal exams are performed with the pelvic exam. I will re-glove my hands and lubricate my fingers for the rectal vaginal exam. I will slowly insert my index finger into the vagina and my middle finger into the rectum. I will palpate to try to feel for any masses, bulges, and that concludes the female GU exam. Now I'm going to verbalize the rectal exam for male and female. For positioning, for females, they can be in the lithotomy position. For males and females, they can be in the side lying with right leg bent across, or standing and leaning forward against the exam table. First, I'm gonna, don my gloves, lubricate my finger, and I'm going to insert the finger into the rectum, aiming towards the umbilicus. I'm going to ask the patient to bear down. I'm noting the sphincter tone and noting for any masses, bulges, tenderness. Then I'm going to advance my finger and feel clockwise, counterclockwise for any nodules, masses. Then with the male, I'm going to inform them that next is the prostate exam and that it is normal for them to feel the urge to urinate. I'm going to move my finger and sweep the prostate with my finger. And I'm going to feel for the size, shape, consistency. And then finally, with withdrawing the finger, I am going to inspect the fecal matter and test for occult blood at this time, and that concludes the rectal exam. Now I'm going to perform the abdominal hands. I would obviously wash my hands, don new gloves. First, with the abdomen, I'm going to have the patient lay down with hands on the side. I'm going to inspect the abdomen. Okay, abdomen is symmetrical. It is flat, no protrusions, no dilated veins, no scar, no striae. The umbilicus no inflammation, no bulges, no aortic pulsation or peristalsis. Next, I'm going to auscultate before palpation. I'm going to auscultate in all 4 quadrants for a maximum of 5 minutes. All right, bowel sounds are no more active in all quadrants. Next, I'm going to percuss for liver span abdomens. Okay, can you press your finger right here? I'm going to measure in centimeters. Liver span is 7 centimeters. Right, you can relax your hand. Next, I'm going to percuss splenic percussion. Take a deep breath. Tympani hurts, so splenic percussion is negative. Next, I'm going to palpate lightly first. Let me know if you feel any tenderness. No tenderness reported, no guarding, no masses felt. Next, I'm going to do deep palpation. Let me know if you feel any pain. Okay. Deep palpation, no masses felt, no tenderness reported. Next, I'm going to palpate the kidneys. Let me know if you feel any pain. Kidneys non-palpable, no tenderness reported. Next, I'm going to palpate the liver edge. Take a deep breath. Okay. Liver edge palpable, non-tender, no masses felt. Next, I'm going to palpate the spleen. Take a deep breath. Okay. Spleen is non-palpable, non-tender. Next, the McBurney's point. Let me know if you feel any pain. Do you feel any pain? Okay. No pain reported on McBurney's point. Next, you can take a deep breath. Let me know if you feel any pain. Okay. Murphy's sign is negative. No pain that stops inspiration. Next, the Rossfing sign. I'm going to palpate on the left lower quadrant and withdraw quickly. Let me know if you feel any pain. Okay, no pain reported on right lower quadrant. I'm going to have you sit on the edge of the bed. Next, for CVA tenderness, let me know if you feel any pain. All right, CVA tenderness, non-reported. And that concludes my physical exam. Thank you for watching.